of our formal program. I think that any of our speakers or anyone else that's participated in this process are available for questions. Sir.
Can you explain a little bit of the disconnect between the fact that casinos seem to have more risk, but those people that are identifying as problem gambling are more likely to be problem gamblers with the lottery right now? Is that an availability issue?
Well, I'm going to ask Sandy to kind of take that question, but generally speaking, it is an availability issue. Lottery is completely accessible to every Ohio citizen, whereas casino gambling is relatively inaccessible at this point. Sandy, do you have anything to add to that?
Just that, generally when we're looking at...
Can you move over to the microphone, please?
Generally, when we're looking at gambling, we have very few folks who only go into casinos, only doing lottery, only other types of gambling. And so what you're seeing is an availability problem, although the sheer number of individuals who are traveling out of state to engage in casino gambling on a regular basis is relatively small at this point. Those that are, because they're also engaged in other types of gambling here in the state, tend to be at higher risk. It's not anything about casino gambling per se. I think it reflects more the fact that you have individuals who are already more engaged in gambling behaviors who are willing to travel out of state.
And when you had a situation where somebody identified as having a problem with VLTs, did you identify that as casino or lottery?
Both, actually. When we look at other types of problem gambling, in addition to casino and lottery, the survey included video slot terminals other than casino, sports pools, sports with a bookie, card or board games with family or friends, games of skill such as pool, bowling, darts, arcade or video games, the internet, investing in stocks options or commodities markets, bingo, horse races at the track and off the track, and fundraising tickets.
So were we seeing that under lottery, casino, or maybe under other?
What I just mentioned, that's under other.
Perhaps, go ahead.
No, that's it.
Perhaps I don't understand the meaning of the word at risk, but it seems to me the average citizen here looking at this issue really wants to know how many people are problem gamblers now and how many will be in 2 or 3 years when you look at this again. We don't so much want to know how many people are at risk, but how many people are problem gamblers now and how many will be in a few years. Why do we keep hearing the at risk? I'm trying to muddy the waters here.
Okay. So, again, this is a survey that does identify problem gamblers as well as 2 levels of risk. If we're looking specifically at problem gambling, which there's an index score that's included in the instrument, depending upon that score, they're placed in one of those categories. The problem gambler is going to experience loss of control and most likely be consistent with our DSM diagnostic criteria for problem gambling. That's 0.3% in the state, and that translates into roughly 26,417 Ohioans. When we look at moderate risk, that's an additional 0.3%, or another 26,417 Ohioans. Moderate risk would be individuals who may experience some degree of consequences of gambling, but it does not. But their behaviors do not meet the criteria for a diagnosis of problem gambling. When we look at low risk gamblers, that's 2.2%. Or 193,727 Ohioans, it's an estimate. Those are individuals who have, again, experienced some, they probably have not experienced any bad consequences for gambling, but nevertheless they've scored more than a 0 on that scale. So when you look at the low risk, moderate risk group, that's 2.5% based on our sample. We're looking at a little over 200,000 Ohioans. That's the group that prevention activities are most appropriate for, targeted prevention activities, which is why we're so concerned with being able to understand what types of individuals those are and how we can better target prevention efforts. The additional 0.3% or 26,000 Ohioans who appear to have a gambling problem meet the diagnostic criteria would be eligible for treatment and would most likely be hopefully showing up in Gamblers Anonymous as well.
When do you anticipate a follow-up? Is there a standard amount of time usually on a survey like this?
We're looking at 3 to 4 years. We haven't selected the actual date yet. But one quick point to Sandy's point to Bill. We need to monitor the degree to which those people in low and moderate risk categories, once they've been exposed to elevated levels of gambling, may be moving into those higher risk categories, which again is one of the primary reasons that we conducted this research at the very beginning of the casino implementation in our state.
Orman, the critics of gambling have often said these are the kind of problems that they feared, that it would cause societal problems and costs. Can you just give us your assessment of this study and how that works into that? Does this look like a big problem coming down the road for Ohio with casinos and racinos?
No, and that's a great question. I think the real answer right now is that we don't know. Again, the whole purpose of this study was to establish a baseline so that we could monitor over time the impact of the increased availability of gambling in our state. And we have great data. I think what we're doing here could serve as a model for how we look at all social problems. I wish we had an opportunity to go back and remeasure on a number of different social conditions. But what we have now is a clear understanding of the degree to which problem gambling has impacted our state prior to the implementation of casinos and racinos, and we're going to be able to go back a few years and measure the impact of the increased availability in our state, and I think we're real excited about that.
So this 2% of money that's going to go to the treatment, does that mean I call that number and I then get free treatment? Or do I have to pay $100 an hour to a psychologist?
It doesn't mean that you're going to get free treatment. It does mean you're going to get subsidized treatment. The other thing that I would mention is that the funds that have been allocated cover both prevention and treatment. And in the early years of this process, we believe that it's important for us to focus the bulk of our resources towards prevention efforts. We need to make sure that every Ohioan has a clear understanding of the risks and the dangers before they make a decision about whether they're going to gamble or not. And so that's going to be our initial focus. But individuals who are struggling with gambling will have access to subsidized gambling treatment in our state.
So any idea, can you give people, what's the usual cost for somebody getting gambling treatment? And what kind of a discount or subsidization are they going to get? How much of it?
Bill, that's a great question, and I might ask my good friend Paul Coleman to kind of field that since he is in the treatment provision field. Paul?
Just to oversimplify it for us, I mean, just in general, what kind of a break is somebody going to get on this treatment cost?
Through the grant that we have through the Ohio Department of Alcohol and Drug Addiction Services, we treat all individuals who are not able to pay totally for free. In the past 2 years, we've treated about 170 people with the DSM-IV diagnosis of problem or pathological gambling. But to emphasize, I think, what Odatis is trying to do, we have also at Maryhaven provided prevention services to approximately 1,600 people here in the central Ohio area, including some high school students.
You suggested that these numbers are comparable with what you've seen nationally. Does this compare, it seems to me that Ohio is already at the rate of how it would compare to states that are already dealing with full-fledged casinos and have been for a while?
I think that the range of studies that I've seen in terms of prevalence of problem gambling range anywhere from 0.1% to 1.8% in the general population. So we're in the lower quadrant of that picture. When you look at other states, for example, Nevada, that has been engaged with casino gambling probably the longest, I think that the rates there are probably closer to 5%. I think when we look at the at-risk as well as actual problem gambling, it's probably over 7%. So we would expect to see some increase over time as additional opportunities for gambling are present in the state.
And did your questioning require the person that you were talking to to self-identify themselves as being problem gamblers, and do we get into a denial situation with that?
Individuals don't identify themselves as problem gamblers, but they do respond to a series of questions that form an index, a scale. For example, have you ever bet or wagered more than you had intended? And it starts to get to some of the consequences of gambling. Do you feel depressed when you gamble? Do you drink when you gamble? And those kinds of questions. And actually, that 9-scale index is included on that CD, so you'll see them. But those are the kinds of questions that get asked that help us to determine where along the scale a respondent falls.
Would we expect people to underreport in a situation like
Yes.
that?
Oh, yeah.
So would these numbers be on the low side?
They probably are.
But I also think that it's important to realize that the scale that we use is pretty standard. So if there's underreporting going on here, there would be underreporting going on in other states or communities that used this index to estimate problem gambling in their area.
What do these numbers tell you about the system's capacity to handle, knowing how many counselors and service centers you have out there? What does this tell you about the need to increase training or availability of health professionals?
That's a great question. One of the things that I had intended to mention, but I did not in the introduction, is that we've been working for a number of years with the Lottery Commission to develop capacity. And right now we have about 500 trained professionals, and we're going to be continuing to train professional counselors on how to address this problem. So I think that generally speaking, we have some challenges around capacity and addiction treatment, but for this particular issue, given the low incidence, we're in reasonably sound shape in order to be able to address this problem right now as it currently stands.
You say 500 was specific gambling addiction specialization, or just addiction service in general?
No, we have 500 individuals who have been trained in the provision of gambling addiction treatment services.